Welcome to Anatomy Dojo. Today we're going to discuss planes of movement and axes of rotation, and to explain why we move in three-dimensional planes. Let's define our axes. Axes are a straight line around which an object rotates. What does this have to do with anatomy? Well, anatomically speaking, our bones rotate around a hinge, and that hinge is within every joint of our body. So thus, the distal bone of the joint moves around an axis of rotation. However, we have three of these axes that we move around. Thus, we move in three-dimensional planes. So let's discuss the axes first. First, we have our x-axis, and the x-axis run horizontally, also known as medial-laterally. Thus, we can call these horizontal axes or medial-lateral axes or x-axes. The next axes we're going to discuss are the y-axes. The y-axes run vertically. You can see here on this line running vertically. Vertical is also known as superior-inferior. Thus, these are our superior-inferior axes. The third axis is the z-axis, and this is really the one that allows depth in movement. It's our third axis of rotation, which allows us to move on that third plane of motion that allows our movement to be three-dimensional. So it's difficult to express this on a flat video. However, z-axes pass anterior to posterior, right through the patient. Thus, we can best express this line as a diagonal line, but really it's a hinge that runs anterior to posterior. Now that we have defined our axes of rotation, let's look at our plane. Planes of motion are associated with an axis of rotation. The first axis of rotation that we have discussed is the x-axis. The x-axis move medial-laterally or horizontally, thus creating a horizontal hinge. The plane of motion that's associated with the x-axis is the sagittal plane. The sagittal plane is a flat surface that divides the body into our right and left side. Now, if we look at this plane of motion right here, the sagittal plane dividing our body into right and left, and we look at our hinge, which is medial-lateral axes or x-axis. So x-axes are associated with the sagittal plane. If you look, you can actually see that the axes of rotation and the plane of motion are at a 90-degree angle. However, the movement itself that's associated with medial lateral axes is, in fact, flexion and extension. Then it is represented by this humerus or the bone of the upper arm moving around the medial lateral axes. So thus, we can analyze that movement happens parallel to the plane at which it's on. Because if you think about your shoulder flexing, that shoulder will be flexing parallel to the plane that divides your body into right and left. However, the hinge, the actual axes of rotation, are going to be at 90 degrees to the movement as well as to the plane. So you can conclude movement on the sagittal plane happens on the x-axis or medial lateral axis. Here we're taking a look at an example of shoulder flexion where the humerus is moving about the x-axis. The x-axis identified here with an X going through the joint medial-laterally, and the humerus moving around the axes of rotation, which are in this case the x-axis, also known as the medial-lateral axis. The plane of motion is the white screen that we see, and so movement happens parallel to the plane of motion. Remember that. PP, plane of motion and movement are parallel. Here we have another example. In this example, we have hip flexion. When we flex our hip, the axes of rotation are medial lateral axes running through the hip, and the femur moves around those axes on a sagittal plane. Now, had the movement been extension, the situation would be the same. It would still be medial lateral axes. It's just that the femur would move posteriorly instead of anteriorly. The next plane we're going to discuss is the frontal plane. The frontal plane divides the body into front and back. So thus it slices the body into front and back. The axes of rotation are anterior to posterior, also known as the z-axis. And so thus the movement that's parallel to the frontal plane, parallel to this box here, is abduction and adduction. So here are the axes of rotations are the x, and if we're looking at the hip, the femur is going to move out on this plane of rotation, kind of like a mime moves around as if they're stuck in a glass. So thus, frontal plane of motion is associated with z-axis. And with frontal plane of motion and z-axis, the movement that's parallel to the frontal plane but perpendicular to the z-axis is abduction and adduction, as well as trunk side bending. Now that may seem confusing, so let's take a look at the next slide. On this slide, we can see z-axis going anterior to posterior and movement happening side bending of our neck, bringing our ear to our shoulder. This is the patient is facing forward, thus this is right side bending, and then going back to center. So you can see how z-axes or anterior posterior are a hinge, and the patient is moving parallel to the frontal plane represented by this box right here. Here's another presentation of z-axis. However, in this case, we have shoulder abduction. Again, our frontal plane here represented by the black surrounding box, dividing our body into front and back. We concluded movement happens parallel to the plane, and so thus shoulder abduction, moving away from the midline, is happening in the same plane as the box or the frontal plane. However, our axes of rotation are always perpendicular to the plane, and you can see here z-axis anterior posterior going through the shoulder, allowing a hinge to bring the shoulder out to the side. The next plane we're going to look at is the transverse plane. The transverse plane, represented here, divides the body into superior and inferior aspect. So if you look at the superior and inferior aspect, trunk rotation happens parallel to this plane sheet that divides the body into half. The axes of rotation that are perpendicular would be the y-axis or superior inferior. However, yes, we can rotate our head on our shoulders, we can rotate our trunk on our hips, but we also have rotation of the shoulder and the hip, which have their own y-axis going through their joint. Thus, all rotational movements will be parallel to the transverse plane, which divides the body into top and bottom, and will happen on the y-axis of rotation. Looking at our y-axis or our superior-inferior axis, running from superiorly inferiorly or vice versa, we have the motion rotation, where your head rotates around the axis. And that rotation happens on the transverse plane. And the transverse plane would be parallel to this motion that you're seeing here. Thus, rotation is parallel to the transverse plane and it is perpendicular to the axis of rotation, which could be seen here. We can draw a 90-degree angle between our plane of motion and our axis of rotation. Another example of rotation is shoulder rotation or glenohumeral rotation. In this case, again, you can see the y-axis or superior-inferior axis acting like a hinge and the humerus rotating around those axes of rotation. And you can see that that rotation is parallel to the transverse plane. Welcome to Anatomy Dojo. Today we're going to look at planes of movement and axis of rotation.